Anthropometry. Anthropometry is the scientific study of the measurements and proportions of the human body. It helps to measure the height, weight, hip to waist ratio, skin fold thickness, head and chest circumference, and mid upper arm circumference. Weight method. In this method, the person is asked to remove their shoes, socks, and any extra clothing. The scales are ready to use when they display 0, 0. To measure the weight, ask the person to stand in the middle of the scale and look straight ahead and stand still. Make sure that their arms are by their side. Wait until the scale settles at a reading and then record the weight to the nearest 100 grams. Height method. In this method, first the person is asked to remove their shoes. Then have them stand back to the wall and place the back flat against the wall or the measuring device. Ask them to place the heels against the wall or the measuring device. Then ask them to look straight ahead and relax. Now depress the lever arm until it reaches the top of the head. Record the measurement to the nearest 0.5 centimeters. The height is measured in infants with the help of an infantometer. In this method, the child's head is held perpendicular to the board. Then, the child's legs are held straight and the board is pulled firmly against the feet. Make sure that the child's feet are flat against the board. Record the measurement to the nearest decimal point. Mid upper arm circumference. This measurement is taken on the left arm with the help of a Shakir tape. First, identify the acromion on the left arm and mark a point on the tip of the bone. Now fold the arm 90 degrees so that the palm of the child is facing up. Mark a point on the tip of the elbow, which is known as the olecranon process. Now identify the midpoint by dividing the upper arm length into half. Hold the tape upright and mark the horizontal point at midpoint. Bring the child's hand straight and wrap the tape by overlapping the two ends. Make sure that it is not too tight or too loose. The reading is recorded to the nearest 0.1 centimeter. The values of the tape indicate different levels of malnutrition in children. Skin fold thickness. This method is measured by identifying a midpoint in between the acromion and the olecranon. Project this mark around the most posterior and anterior surfaces of arm as a horizontal line. Mark the midline with a vertical line. The skin fold is then measured by using a Harpenden caliper or Lang caliper along the long axis of humerus. Head and chest circumference. In this method, the head is measured with the help of a tape. Place the tape around the child's head above the ears and midway between the eyebrow and the hairline to the bump at the back of the head. Hold the tape firmly around the child's head so that there is no space between the tape and the child's head. Be sure not to hold the tape so tight that the child's skin bulges around the measurement. Read the measurement and record it to the nearest decimal point. Chest circumference. To measure the chest circumference, take the measuring tape and wrap it around the nipple line of the baby and measure it. Record this measurement. The chest circumference of a baby should be 1 or 2 cm less than the head circumference. Waist to hip ratio. In this method, first the waist is measured by finding the midpoint in between the top of the hip bone and the bottom of the rib cage at the level of umbilicus to the nearest 0.5 cm. The subject should stand straight with relaxed muscles and arms at the side. The measurement is then taken at normal expiration. Make sure that the tape is not too tight and is horizontal to the floor. Hip circumference. It is measured at the point of the greatest circumference of the hips. The tape should be in close contact with the skin without indenting the soft tissues. Record the measurement to nearest 0.5 centimeters. The waist to hip ratio is then calculated by dividing the waist measurement to the hip measurement. The waist to hip ratio of around 0.8 in females and 0.95 in males indicates central obesity and is considered high risk for diabetes and cardiovascular disorders. Body mass index. It is a value derived from the mass and the height of a person. It is defined as the body mass divided by the square of the body height and is expressed in units of kg per meter cube. It is used to classify the malnutrition in non-pregnant and non-postpartum adults. It is not an accurate indicator of nutritional status in pregnant women or adults with edema. Anthropometric methods are safe and simple with inexpensive and portable equipment. It requires minimal training and can be used to evaluate the nutritional status in population studies with large sample size. However, it is prone to error with limited nutritional diagnosis and cannot detect the nutritional disturbances in nutritional status over a short period of time. Thank you.